Good morning, I'm Tina Jennings. Now, the first time I ever saw these, I thought this is really going to be a game changer for those people who suffer with loose dentures or those who may be missing some teeth. I'm talking about mini dental implants. Dr. David Tambor is here to explain exactly what they are and how they're helping so many people. Doctor, thank you for coming back.
Good morning, it's my pleasure.
Let's kind of start with your background, just in case someone didn't catch you last time. Tell me how long you've been in practice.
I've been in practice a little over 30 years.
Yeah.
Been placing, we placed our first mini dental implants 17 years ago.
Wow.
Yeah, so they're tried and true. The research has been done on them. They're really wonderful.
Now, they've been around, like you said, for a long time. They've been tested. We know they're really great, but this might be new information for somebody that's watching, so I want to kind of blow their mind away. How is this really changing people's lives when they realize that this is available?
Well, what it really does is, I'll give you a story.
Yeah.
Had a grandma come in who, while she was hugging her granddaughter, her dentures fell out.
Oh.
And she said to me, "I never want that to happen again, ever." And so what we did for her was we made her what's called a fix-on-6. And it's a permanent set of teeth. This is exactly what it is. And we replaced her denture with its porcelain, actually they're zirconia teeth, and they just snap on and they are solid. They don't take them out at all. So pretty much they come in twice a year. I take them out, clean them up, put them back in, and they're able to eat anything. And it changed her life. She's just thrilled.
Wow.
Yeah.
I love to hear the personal stories of, how someone felt before, how they're feeling afterwards. So I know you're giving kind of a slight overview, but kind of tell me more in depth exactly what are these implants and how are they kind of different from the traditional implants?
That's a great question. Traditional implants that have been around for quite a while that require surgery to cut the gum, drill a big hole in the bone, screw this big screw in, close it back up, and then let it sit for about 3 or 4 months, and then you can put teeth on it. They work great, but there's a whole lot of issues with it in terms of discomfort, cost. Mini dental implants, there's no surgery or minimal surgery. They are virtually painless. They are very, very quick, so you don't have to wait. In fact, if you have a denture, we can put in 4 mini implants and seat the denture and retrofit it that visit and walk out with
Wow.
a solid fitting denture. The other big issue is that they cost about half or less than the cost of conventional implants.
Wow. All of that, I think, is probably a lot of people had complaints about with the previous implants. And so now that we have something that's covering a lot of that, like you said, it's so fast to have it. You're going to see those results right away. And you were talking about the cost as well and how it's cutting that down. So are we talking about, like, we're basically getting rid of dentures? Like, this is a replacement?
That's really the ideal. If we could do
Yeah.
that for people, that's the ideal way to go.
Yeah.
And we can. We really can eliminate dentures. And there are about 50 million Americans who still wear dentures in this country. So this is a time now where we've gotten to a place where we can eliminate dentures.
And so how do we know if someone is the right candidate for this? Is the first thing they do is to come see you?
Yes, they come in and we do a consultation. It's complimentary, including x-rays. We do not charge for that. Actually, about 98% of people are candidates. So it's pretty unusual. One of the great benefits of the minis is that they don't require as much bone. For a lot of patients who require more bone, if they want conventional implants, they need bone grafting and all kinds of extensive surgery. Mini implants don't require that most of the time. So about 98% of people are candidates.
And I know we're talking a lot about people that are denture wearers, but we also mentioned people that are missing teeth. That's also another
absolutely
community that this will help.
A lot of people. You could be missing 1 or 2 teeth, and in a case like this where somebody's just missing their teeth, we can make a beautiful 3-tooth bridge, and it fits on, and it looks, you can't tell.
Yeah.
And it gets glued in place. It's as if you got your teeth back. And this is done, literally can be done in 1 visit.
Wow.
We just take 1 impression, the patient comes in, we put the implants in, put the bridge in, 1 visit.
One visit. And I love that we're talking about whether it's a full mouth of dentures we need to do, whether if it's 1, 2, 3 teeth, whatever it is. Come in, let's see what we can do for you. You could walk out that day a totally changed person. I know last time you were on, we were talking about the confidence that it gives you.
Absolutely. Like that grandma.
Yeah.
I mean, the idea of it was appalling to her.
Yeah.
She was so embarrassed. And the idea that now her teeth are solid, she can smile, she can eat whatever she wants, she just doesn't have to worry about it anymore.
Oh, I love this. I love that, we're getting this word out. We're able to see it for ourselves when you kind of snap them in. We see how secure they are and how much you could do for someone. So I'm going to remind them how to get a hold of you. And of course, that first step is to come in and see if they're that candidate.
Sounds perfect.
Doctor, thank you so much again. Now, the Tucson Mini Dental Implant Center is located at 6026 East Grant Road. For more information, call 298-6026 or visit TucsonMiniDentalImplants.com.